I welcome everyone to the Medjack webinar, Medjack Global Webinar Series V4.0. This is our fourth iteration for those of you who are joining us for the first time. The topic we've selected for today is redefining healthcare, innovation at crossroads of industry and academia. A bit of background, the Medjack Global Webinar Series is dedicated to uncovering the untapped potential of innovation, creativity, and entrepreneurship, ICE, as we lovingly like to refer to it, within the realm of healthcare and beyond. By bringing together like-minded individuals, this series aims to illuminate new possibilities and expand horizons in areas with insights from accomplished guest innovators, creators, entrepreneurs, researchers, and educators. Medjack is AKU's first ebook, which has been penned down by a total of 14 co-authors. It's a toolkit for serial innovators and entrepreneurs interested in low-cost and low-tech processes in healthcare and beyond. Today, we've selected Chapter 9 of Medjack as the conversation starter, Chapter 9, C2I, Create to Innovate. With that, I would like to introduce our moderator for today's session, Dr. Asad Mia, Professor and former Chair, Emergency Department, Khan University Hospital. Hi, Dr. Asad. Thank you for agreeing to be the moderator for today's session.
Thank you, Marine.
And I'd like to welcome our guest for today's session, Mr. Irfan Khan, a distinguished leader who has been at the forefront of transforming healthcare across continents for over 25 years. Our esteemed guest brings a wealth of experience from his roles in leading hospital chains and his involvement in various capacities across the healthcare sector, including as the Chief Commercial Officer for Evercare Healthcare Group, where he oversees operations spanning across 3 countries in Africa and South Asia. His journey is marked by dedication to institutional building, bridging the realms of science, social sciences, and humanities, and nurturing entrepreneurship within the healthcare industry. His work extends beyond traditional boundaries, impacting the lives of communities in emerging markets of Kenya, Nigeria, and Pakistan, demonstrating a profound commitment to improving healthcare delivery and education. Hi, Irfan. Good to see you after a long time. Hope you're doing well.
All good, yes. Good to see you too. Thank you.
Thank you for agreeing to be our speaker for today. Before I leave Dr. Asad with questions, a few housekeeping rules. I would appreciate if everyone mutes their mics, and comments, questions, suggestions are welcome in the chat space provided. This is meant to be an interactive session, so if you have any queries, comments for our guest speaker, please put them forward in the chat space provided. And with that, over to you, Dr. Asad.
Excellent. Great. Thank you so much for that. Thank you for getting us started, Marine. And hello and hi to everyone. Assalamu alaikum. Good evening, good morning, wherever you are. Thank you so much for being here for the Medjack session of today. And huge amount of gratitude goes to Irfan for agreeing to be our speaker. This is the 4th year of the Medjack Global Webinar Series, and every year we've kind of tried to do something different. And this year, this time around, there is going to be something different. It'll be kept as a surprise for those of you who don't know what the surprise is, and even Irfan doesn't know. So Irfan will be a surprise for you as well. Okay. And once it's upon us, then you will know that's what the surprise aspect of this webinar is. I will re-emphasize the things that Marine said about this being an interactive session. We will have a great conversation with Irfan, but we want individuals to put their thoughts or questions, comments in the chat space, or you can unmute yourself and then go ahead and ask a question, because that's how we want this to be much more of an educational and interactive session. Having said that, let me delve into the chapter that we selected for Irfan, and that's Chapter 9 of the book Medjack. For the yes, this thing doesn't kind of project really. Oh, there we go. I don't know if you can see. Oh, doesn't project really well. But the book's Chapter 9 is a deep dive into sector agnostic innovation and business incubation. So what that means is that rather than just focusing on one vertical, i.e. healthcare, the premise of that chapter through various examples or case studies is that no matter what the discipline, when you have an interplay or cross-pollination of ideas between different disciplines, an example over here being humanities, social sciences, medicine, nursing, and so on, the quality of the thoughts or the quality of the ideas and the potential innovations and business incubations that can result, that's a lot better because of the interdisciplinarity of that kind of innovation. And so that's what the chapter makes the case for. And so my first question is related to that chapter. And so Irfan, the chapter talks about, I mentioned different disciplines coming together, but also makes a point about going past health and disease. So rather than being disease-centric, being patient-centric, and even going past that and looking at the whole human being and human development, let's say, right? So looking at the human being with respect to the environment. And so environmental issues become of a lot more importance as well. So when you think about disease centricity moving ahead to patient centricity, moving ahead to holistic human development, what are your thoughts around that? Have you observed something like that in your own experience of running hospitals? So let's start with that.
Okay, great. Thanks, Dr. Asad. I mean, to answer that question, really, I think I'll sort of go a little sort of, backward and look at it from a bigger picture. The markets, for example, that I'm working in at the moment, these emerging markets in Africa, South Asia, so Pakistan, Nigeria, Kenya, we have in these markets a lot of people who basically suffer on a day-to-day basis on just practicalities of life, living life. So when it comes to understanding these markets and the holistic approach to these markets, we have to think about, not just sort of in the healthcare realm, but like you said, for life, for just day-to-day operations and, for example, getting to work even. Security, safety. And I think those are things that I'm starting to see in our markets where, it starts with not just, I'm not just talking about our patients, but I'm talking about our employees as well. So if we start with that to say, how do you create organizations or teams that take care of that aspect of these emerging markets and understand these emerging markets. So I think a lot of the issues that we face are the understanding of these markets and the nuances and the discrepancies in these markets. And they stem from, I think, basic things, rather than more complicated things. So sometimes we have a tendency to look at the more complicated, but I think the most important thing is to look at what are the basics in these markets, what is needed, and how do you focus on those. So from the Evercare platform, what we try and do is recognize the anomalies and the discrepancies or the difficulties that our staff face, and then help to align them or support them. So then if they have a better experience or they feel that they are respected or looked after, for us that translates into a patient experience, a good patient experience. So for me, the starting point is really from an employee's perspective. How do you look after your employees to ensure that your patients are looked after? So it's a complete sort of stream, but I think it starts with understanding the wellness, the well-being of your employees.
Excellent, thank you. That makes a lot of sense. And so, if I were to kind of like summarize, right? So, what I'm hearing from you is that looking at this holistically, and looking at human development, human beings in relation to the environment, that is important for even modern hospitals. Would that be a fair kind of assessment?
Yeah, I mean, what do you mean by that? Like, what, if you can expand?
So like similar to what you're saying, right? So you're saying safety, security, and those kinds of, human being safety and security, right? Food shortages. Let's say like, I'm talking kind of like broadly looking at the Sustainable Development Goals or SDGs even, right? So rather than just like focusing on the patient and the patient's disease and in the hospital setting, we're looking at it more holistically, in other words.
Yes, absolutely. I think, there's a lot of focus now on, preventive sort of medicine and healthcare. But we do see discrepancies in different markets. So differences in different markets. So for example, in Nigeria, I've seen that wellness is very popular, very good. People want to do a wellness check. People are ready to pay up for doing a wellness check, up to $1,000 to pay for a wellness check. And that shows the, I would say, the thinking or the smartness of Nigerian people, because they understand that, preventive measures are better than, reactive and when you get sick going into the hospital. But if I compare that market to the Pakistani market, we find, that a lot of the people in the Pakistani market are reluctant to do wellness checks and tests because they don't want to spend money, unless they're sick. So they'll say, why should I spend this money, beforehand? I'll spend it when I'm sick. So I think there's different markets, and I think that talks to a bigger point that I also wanted to make on this webinar is the fact that there's not one formula for all markets. Every market is different. And I think one of the things that I've learned as a leader in these markets is that you need to understand the cultures, the nuances, the differences between the markets. And you can't, impose or roll out similar things in all markets. Every market is a little different. And once you understand that, then I think it also helps and makes it easier. Plus, it helps you to link with the people of that country. And that is also an important thing for especially expatriates or people who are coming in from a different country or a different culture, to understand the culture that they are in and working in. And I think that before anything else, that itself is a starting point. The respect that you give the local people, the training and the communication with the local people, in any market, be it Kenya, Pakistan, Nigeria, or other markets. And I think these are sort of nuances, I think, that are, particular to these kinds of markets.
Excellent. Those are fascinating points. And thank you so much for bringing them up, because those were tied into some of my follow-up questions as well. And so you've already brought it up about emerging markets and how it can't be a cookie cutter approach, right? So different markets and different countries means like you have to approach those nations differently as well. Great, excellent points. So there's a comment or a question here. Excellent. We want people to actually be pretty proactive about this. So I'll just read this out. So Rizwan Khan is asking, well, great discussion, and thank you for bringing these discussions and panels to us. Well, you're very welcome. Just wanted your thoughts on the role and importance of wellness as an important pillar in redefining healthcare. Reactive healthcare is hospitals and doctors, which are important, but preventative healthcare could be wellness-based, which includes protocols such as deliberate hot and cold exposure, exercise therapy, etc. This space is growing globally and in Pakistan too. So your thoughts on this would be interesting to hear, and any personal experiences with such protocols. Do you want to take this now?
Yeah, sure. I think I've kind of spoken to a bit of it. Like I said, a lot of the markets are different. So when it comes to some personal experiences, I've seen this, be a major throughput or a major traction that I'm seeing in the Nigerian market. And it seems like the West African market is very prone towards this sort of preventive healthcare and wellness. And so we are seeing good traction there. I think in Southeast Asia, especially Pakistan, maybe not so much so. And I think, for the group here, it's an interesting one that how do you communicate this? How do you educate those populations that maybe don't understand this or don't see the value of this? Because there is definitely value in this. But I would also then go back to one of the points that I mentioned earlier, is that it's not only about the patients, it's also about your staff. And so how do you look after your staff, and what's the well-being and the wellness programs in your organizations, not just hospitals, that you have, for your staff and the well-being of staff. So it is definitely, I think Rizwan's comment there is very, prudent, because it is, the sort of the cutting edge. Now, to add on to that, what I would say is also, we are now starting to look at what I call beyond beds. So what are those streams that are healthcare related, but not necessarily in the hospital? And so, in that comment, what he's saying is, how do you go beyond hospitals? So reactive healthcare is in hospitals and doctors, but preventive healthcare is more at home. So, then we are going into that home care market, intermediate care, palliative care, there's all those kinds of work streams. And then the other sort of area that I think is upcoming is medical devices, because these are now, coming to be very important in healthcare, especially preventive healthcare. So these are all areas that I call sort of the beyond beds, revenue streams or work streams within hospitals and healthcare settings.
Excellent, great points. And they're all speaking to the title of the session, which is Redefining Healthcare, Innovation at the Crossroads of Industry and Academia. And so a lot of things that you're mentioning, tech-based innovations, let's say, or health at home model, and bringing things to your bedside at your home, actually. In your experience, what's your personal take on technology in healthcare? Are you a techie? Do you like tech, high tech, low tech? What's your take on that?
So, it's interesting. I mean, I think, technology is become, how would I say, the in thing, or everyone, wants to kind of, call themselves tech savvy and have all sorts of technology all over the place. I have a bit of a different sort of take on this, especially again within our markets, is how do you look at these technologies, within the basics of what you need. So, I mean, what I'm trying to say is that, you need to get the basics right before you move into sort of technology, especially sort of high tech things. So sometimes I find when there's sort of ground problems, people tend to think technology will solve their issue. But I think technology is more of an enabler to help you maybe make something more efficient, etc., but will not solve the problem per se. And I think what we need to do is figure out, the basics. So I always say in running hospitals, what we need to do is get the basics right, sort of the bread and butter right. And then technology becomes an enabler to enhance that service, shorten waiting times, or, enhance an experience, or bring in better protocol, bring in better patient safety, etc., those kinds of things. So technology can enable doctors and nurses to do their jobs more efficiently, better. It's like flying a plane. I mean, the pilot is there, the computer may be flying the plane, but the pilot needs to be, sort of watching and checking, and at the end of the day, the human being is an important, component of that. But so that's my take on technology. I think for sure we need to look at technology now. Again, in the Evercare platform, we have amazing teams who are building this technology. So we have done some unique projects, some unique innovative technology projects. from basics to more sophisticated. So for example, in our hospital in Lahore, we have developed our own EMR system with local young developers who have developed this world-class EMR system, that is now going to be, sanctioned across our hospitals. So that's nowadays sort of the basic thing in a hospital that you need to have. But then in our Kenyan team, we've seen some innovative products when it comes to registration of patients. So when a patient walks into our hospitals or our medical centers in Kenya, what we call that program is a door to doctor in 3 minutes. And they can register on this screen, they can pay, and they don't need to interact with anyone, they can go straight through. So this is talking to, for example, one of the biggest complaints we have across our platform from our patients is waiting times, and this is a common issue in all hospitals across the world. So how do you use technology to help those kinds of issues? So it doesn't have to be, expensive and high tech. And I think it talks to, your group and the work that you guys have done is how do you do low cost technology. But I think one of the initial sort of discussions that we've had is also that innovation is not necessarily only technology. It's thinking as well, and it's design thinking, and it's thinking through processes and how do you make those processes better. So yeah, let me stop there.
Yeah, excellent. Yeah, thank you. So well said. So from the fact that you've kind of mentioned or emphasized that technology shouldn't always be the go-to, and that does not mean that we should not utilize technology, but there's always an approach to technology. Even in the book Medjack, there's a chapter on tech-based innovation, and it makes that point actually at the end of that particular chapter that don't get stuck by through technology. There's something called technology bias, right? So for every problem, you're going to throw tech at that problem, and at times you don't need sophisticated technology. It could just be process-based re-engineering. And in healthcare, in hospitals and clinics, there's a lot of time that we see that just minor tweaking of process can make a huge difference in terms of patient satisfaction and employee satisfaction as well. So does it really require that level of technology? No, not necessarily. So I think that's why it's something that we kind of keep emphasizing to our students as well over here. So thank you for mentioning that. So Irfan, the chapter 9 talks about sector agnostic innovation and incubation, and that is like, different disciplines. Doesn't matter. You don't have to kind of like just fixate on just medicine or healthcare. For health related or human development related innovation, you could look into humanities and social sciences, and you've done something related to that as well. So it'd be great if you tell us a bit about your involvement with humanities and how that has influenced your approach to healthcare.
So, I mean, my sort of experience within that domain of humanities, etc., was at the Aga Khan, actually, with the Faculty of Arts and Sciences, development, academic planning, facility planning in Arusha, Tanzania, for that campus that's to be built there. So, in that process, we sort of worked through how do engineers, doctors, nurses, business people, study together. How do they work together? How do they study together? And a lot of the discussion around that was, the realization that a lot of, for example, doctors and nurses, when they come out into working environment in the hospital, they need to work together. But when they study completely separately. And they go through their years of studying without really interacting. So how do you get them to interact at that point when they're learning and learn together, so then they can work together? And I think that's, that was an important sort of learning lesson learned during that period. And so I think, when it comes to sort of the humanities side or the social sciences side of healthcare and what we do, I think those are the kinds of things that we need to kind of look at. Again, very basic, that how do you, it sounds basic with that you need to get teams to work together. But surprisingly, you'll see on the ground that a lot of people, a lot of teams, don't work together well. And it's not because they don't want to, it's just because it's not the norm, and they've not been taught that way. And so how do you bring these teams together to work, and as you know, healthcare is very much teamwork. It's a lot of people involved. And that's why I feel it's one of the more complex, sectors that one can manage, because you've got a lot of teams that need to work together, and it's about patient safety, life, someone's health, and it's it cannot be joked around with. So I think those are the kinds of things. Now, in our on the Evercare platform, what we look at, we are a private equity based healthcare organization, so we are for profit, and so how do you link that to quality, to patient safety, but also more importantly to social impact, in the markets that you're having. And the belief is that you can have, what we call the double bottom line, which is a financial impact, but also a social impact. And it doesn't have to be one or the other. You can actually have both of these. And I think the Evercare platform, projects this and organizes this very well, to see, the different sort of aspects that you have, especially in these countries, and the earlier discussion we had about how do you engage with communities, how do you engage with patients, how do you engage with your employees, what's the wellness, the well-being, how do you uplift society when it comes to sustainability, what is your sustainability projects that you're doing, what is the community engagement that you're doing. So I think all those aspects are the humanities, the social sciences aspects of, running organizations. And like you said, not just healthcare, but any organization.
Great. Yeah. Thanks for that. And so I was just wondering, you've worked in various hospitals, you've worked in different countries and different continents as well. And so based on your experience, Asia and Africa, private as well as public, or well, I wouldn't say, I don't know, public or have you worked in a government facility in any of these nations, or would you be able to compare private
No,
versus
not worked in government. I think somebody is not.
Naveed, you have to mute. Thank you.
Yeah.
Okay. Go ahead.
No, I haven't actually worked in a government hospital per se, but worked with government hospitals, obviously, and with governments. I think that is also an interesting aspect. Again, in our emerging markets, the governments are usually not very strong. Lots of discrepancies. So how do you work with them? Government insurance schemes, I've got a lot of experience with that area, and how do you sort of handle that and work with that? So there's different aspects of sort of that, but not worked directly in government hospitals. Yeah.
Yeah, that's fine. So my question was really about like the comparison between where when you compare different organizations and different countries or different continents even, how do you think innovation or healthcare related innovation, how have you found it to be different? Let's say Pakistan versus Nigeria or Nairobi, and how would that compare to North America? Because you obviously have a lot of insight as to how things happen in North America, based on collaborations, perhaps, and so on.
Yeah. So I mean, what I would say is it's I would say Africa and African markets are probably maybe in some ways sort of more advanced, which would be a surprise to a lot of people. So for example, the Kenyan market, I would say in the innovation domain is quite advanced. There's a lot of innovation and innovative products that come out of Kenya, like the M-Pesa, etc. Kenya is sort of a pioneering country in those sorts of innovations that have taken on the world. So what I find is that these African countries, especially, the way they are different than the Western countries is that they can leapfrog. So they don't have to go through the steps that every Western country maybe went through, and they can sort of go from 1 to 10 without going through 2, 3, 4, 5, 6, 7, 8, 9. And so then they've sort of leapfrogged and moved forward, and so they have a chance to kind of be the leaders in innovation. The detriment or the hindrance is always sort of funding, budgeting, etc. That sometimes becomes the hindrance. I find the difference between the emerging markets that we're in. There's a lot of like I said, Africa is moving towards being more innovative. You see a lot of the innovation in these African countries. I would say in Pakistan probably less so. And it would be interesting to sort of dig into that to see what's the sort of the underlying reasons for it. And compared to the West, I think again there's the West sort of takes it for granted. The US probably there's a lot of innovation that's just part of daily life, etc. And you sort of take those things in your stride, and it's a day-to-day thing. But in African markets and our South Asian markets, I think it's more of a specific thing that people want to look at.
Great. Mehreen, you have a question? Go ahead.
Yes, I do. So thank you, Irfan, for sharing, your experience about innovation in different countries. I'm also interested to know about Evercare's vision of integrating. So we spoke a lot about innovation. I would like to know Evercare's vision of integrating, say, research into the existing models of the organization, or how important do you think is it to integrate research within the existing processes of the healthcare organization?
So thanks, Mehreen. I think research, is an area that is, not automatically picked up and actioned especially in the private sort of equity world. But for sure, it's an important one. And I think we link very nicely to it because we see, a whole load of patients across our countries. We see all sorts of different types of patients, all specialities. So the data that we have is absolutely precious for doing research and available for research. And so what we are trying to do now is kind of, sort of how do we link with academia? How do we get into that research domain? Because also, when it comes to healthcare, what I'm very clear about is that, it's all about your doctors, and you need to, what's the professional consultant level that you have, and the life of a doctor is the cutting edge is academia and research, publishing, etc. And so how this is an interesting area that we are now sort of looking at and starting to focus on, is how can we link our day-to-day sort of operations and running hospitals as a private equity-backed healthcare group, but then linked to academics and research, and allow our doctors to be to participate at a sort of a world forum level to in different research areas and projects, etc. And I can give you a specific example that we do across our platform now. We have this set up in Pakistan, where we started what we call the Hear This program. And this is a program for children, mostly under 5 years of age, who have hearing impairment. And what we do is we implant, this cochlear implant, and this enables this child to hear and then speak and go to school. So it's a complete program that doesn't only just implant the cochlear implant, but also then does speech therapy, etc. So it's a multi-year sort of program. And we have launched this in our country, a hospital in Pakistan, in Lahore, and now we are started it up in our hospital in Nairobi, Kenya. And we are, in fact, on World Hearing Day, which is coming up in a few days, we are actually setting this up now in our hospital in Lagos in Nigeria. Now that is a very interesting project because it links to research. There's what is the reason for these kids being born with hearing impairment. There's a whole village, South Punjab in Pakistan, where almost 90% of the children born in that village have hearing impairment. So this is an amazing research project waiting to happen. And so we are at the end, of it, where we are helping by implanting, etc. But then if we go backwards, how do you get into that whole research realm of why is it happening and get to that, the root of it? So I think there's good links like that in our hospital. For example, in Kisumu, which is Western Kenya, sickle cell disease is big, and so our hospital there and our team there is working with a lot of international companies and donors, etc., to do research on sickle cell disease. So in the areas that we are in, there's a lot of research, etc., that can be done, should be done, and I think it's again a good collaboration between hospitals, healthcare, private equity, academia, and government. So, for example, Nigeria, malaria is a big deal, and what's the research angles on that we can link in as a healthcare group?
Great question, Marine. Thanks for that, and ties into the title again, right? So it's the crossroads of industry, which is another way of calling, I guess, private equity industry over here and academia. And so, and Irfan and I, we've had this discussion before as well, that there's a lot of time that you can implement innovation frameworks and then re-engineer research questions into what you're finding or what you're implementing and what your outcomes are from innovation frameworks. And that could be something really interesting for Evercare to consider as well. Because there's a lot of things that are happening and they're very innovative within the Evercare landscape. Okay, so there are a few questions here. I'll just read them out. There's a comment first by Dr. Tazeen. Thank you so much for believing in us at Evercare Lahore. Okay, and then there's another doctor who's asked, regular teaching and training sessions are an important part of any hospital to flourish and progress in academia. Is Evercare working on it? And Evercare has any plan to make its own medical college? Lots of questions. And then there's another question, same person, welfare of employees working in any organization is also important. What measures is Evercare taking for the welfare of its employees? I don't know if it's related to the topic, but please go ahead. On.
Sure, yeah, I can quickly answer those. I think when it comes to the first one, regular teaching and training sessions, for sure, I think we are very focused on this, and we do a lot of training, teaching across our different workforces, across our different countries, from nursing training to MO training, to consultants, to admin staff, to patient services. So there's, all sorts of training, but I think we go one step further where we also do community sessions, training, awareness sessions, awareness talks. So we do this in our hospital, but we do it within the communities around our hospital as well. And we go into the different communities to raise awareness, to do some talks. So recently there was the World Heart Day. There was, different days like this we participate. So like I mentioned before, the World Hearing Day is coming up, this weekend. And so we are doing, awareness training sessions, talks, etc., in all our countries. So that is a very regular thing that happens, and we are doing this, very regularly. does Evercare have any plan to make its own medical college? So far, no. That's not something that we are into. But for sure, there is definitely thoughts around nursing training, because nursing retention in our markets is a major challenge. And so we have always toyed with this idea about how do you build yourself a pipeline of nurses, and how do you make the nursing profession in these countries much more mainstream and much more respected, and understood by the people. But also, how do you enhance the training of the nurses? And so in a lot of our hospitals and countries, what we do is we do extensive orientation sessions for our nursing team that joins us. So then they have basics that are corrected. So I wouldn't say medical college, but nursing college, nursing education training. Yes, maybe that could be something. One thing that we are looking towards and partnering with different companies is skills lab and skills training, and so not just for doctors and nurses, but also for allied health professionals. And so that's something that we're quite excited about, and we are looking towards. The last one was about welfare of employees. So I think I talked about this earlier, but I can give you an example. The question was what measures Evercare is taking for the welfare of its employees. There's different various measures that we take, and one of them is, for example, in our hospital in Lagos, the institution is away from the mainland. It's on an island, and so transportation for staff to come in sometimes is a challenge. So what we did as Evercare for the welfare of our employees is started bus services, transport services for our staff. And so this is taken on very nicely, and it has been very well appreciated. So that's one example. In all our different countries, we provide different discounts for our employees at different supermarkets for basics that are needed. The month of Ramadan is coming up. We usually give some sort of package to our employees for that. So there's various different programs, and I think I'm happy to say and proud of the fact that the Evercare platform, I think, does take this very seriously, and the wellness of their employees and the welfare of the employees.
Excellent, great, thank you. Thank you so much for giving us an update on that. And so it's interesting because I think now I take back my earlier point about not being relevant. I think this is really relevant actually, because we are talking about patient satisfaction, you're talking about staff engagement, and you're talking about things that would help your staff feel well taken care of, right? So excellent. So we don't have any other question or comment as of now. So we'll keep continuing. We'll go on with some of the other questions. So you've mentioned, and we've mentioned, I guess, a few times, private equity and emerging markets, right? So for those of us who are not familiar, okay, so what exactly is private equity, and what would be the opposite of private? Like public equity, is it like publicly owned equity or something like that? Just for me to understand better what private equity is. And then emerging markets, right? So we're being considered in emerging markets. So what's the definition? Like, is it like a certain cutoff or like some number or ranges, like income, like low middle income or low income nations and high income nations? Is it something along something like that, like a range or something?
Sure. So, I think, private equity really is, investors who want to, invest in various, different sectors. So it's not necessarily just healthcare, and they want a return on their investment. So it's like any business or any businessman who, would put in money into something to create value and make a profit. And that's what private equity is about. You know, and within the healthcare domain, sometimes it's frowned upon because people think you shouldn't be making profit in healthcare. But I think that is also something that you know, is misunderstood. And I think there is no harm in that, as long as you are quality conscious and ethical in what you do. And I think that is a whole other topic maybe that can be discussed or should be discussed, because it's an important one. And ethics in healthcare and education, I find in these two sectors, unfortunately, sometimes is very much missing and very much important. But let me not get into that at the moment. The other thing, so private equity, and then the other question was emerging markets. So I think emerging markets is just it's a nicer way to you know, to say sort of third world countries. You know, people don't like to use that those words anymore. You know, what's third world, what's first world, what's second world. So I think it's now called emerging. But to me, I think what, you know, the word emerging means these are markets that are upcoming. You know, these are markets that have potential. These are markets that actually can, you know, change the game in many ways. And so that's the way I see them. You know, that when we talk about emerging markets, these are markets maybe that would be future leaders in different sectors, in different areas, in, you know, in different you know, in different ways. So to me, that's what the emerging markets are. To be honest, I'm not sure if there's a very strict definition of, you know, emerging markets, and, you know, is there sort of the per capita income, or, you know, what's the, you know, I'm sure there would be some guidelines behind it. But for me, I think the emerging markets are the markets in which there's definitely potential. And we see that. Now, as Evercare, what we want to do is bring out that potential. You know, how do you engage again with the culture, with the people, and bring that potential to the forefront? And I find that sometimes in these markets, again, the people working in these markets maybe don't see the potential that they have. You know, I think sometimes even the governments don't see the potential that, you know, those countries have. And they need to align, you know, to gain that potential.
Yeah, great. Thank you. Thank you for clarifying those points for me, Irfan. And I was also, you know, I was thinking based on emerging markets, right? So hopefully these markets are not being exploited in a certain way as well, right? Because we're talking about ethical healthcare as well. So maybe there are checks and balances as well as to, you know, what exactly is being done, and so patient safety, patient quality in a certain way hopefully it is being ensured as well. Do you know, is there evidence, or maybe I don't know, like maybe there's research that's been done that what about patient outcomes, like if compared to, like, I don't know what the opposite, well, you know, traditional academic maybe healthcare models, are the patient outcomes better compared to, you know, newer ways of doing healthcare, which is private equity perhaps, or some other model, or we don't know, not enough studies, or probably I'm assuming that from emerging markets, we probably don't have data as yet as to what works better, and what kind of outcomes, and in your opinion, what kind of outcomes do you think one should look at, like patient outcomes, like clinical outcomes, or morbidity, mortality kinds of numbers, or something else? Perhaps staff engagement, staff satisfaction, these kinds of hospitals? It's just a thought. It's just a question. I don't know. I'm just interested in these different models.
So, you know, I mean, what I would say is, you know, patient outcomes, like you say, are not, I think, formally, officially sort of measured really within these sort of markets. And of course, also, you know, the sort of legislation, accreditation, policy behind a lot of healthcare sort of related services is not existent in a lot of these countries. So so outcomes in that sense probably are not you know, sort of a mainstream work stream for hospitals. But I think, again, what we tend to do within our hospitals is look at those sorts of outcomes. And so we have a very robust quality team that looks at a lot of the main indicators when it comes to patient safety and quality, and those define the outcomes. So the outcomes from surgery, for example, and going back into the OR within a certain period of time, things like that are measured, and we look at it. We watch our sentinel events, very closely. We watch any adverse events very closely. There's proper root cause analysis and proper investigations done. Now, these are things that a lot of the within these countries, this is not an obligation to do as such from a government perspective or a legal perspective, but as a responsible sort of healthcare platform, we ensure that we are upfront with the way we approach things. We are ethical with the way we do things. So I think that's really what from that perspective I would say.
Yeah, thanks. Definitely. I think it's a lot of points to ponder as well, and interesting potential research, as Marine was also alluding to. I think there's a lot of potential to kind of study these kinds of models as well. Marine, you have a question, and then Uzair has a question as well.
Well, Asad, I'm going to take 3 minutes or maybe 2 of everyone's time, and I would really like to get some rapid fire questions in, which was our surprise element. Irfan, you're not prepared, but we have a few rapid fire questions for you, if you're okay with them. First question: favorite book on innovation or your last read?
Well, if it's rapid, I can't really answer that too good, but Medjack, I think, would be the book that I would say immediately, because that's the latest one that I've skimmed through, at least.
Great, we'd appreciate that and welcome that feedback and answer. Okay, top 3 qualities of a successful innovator in healthcare.
I would say, honesty, thinking out of the box, and not necessarily following, a certain pathway. So sort of going with the flow on sort of gut feeling and how you want to do things.
Great. Okay. Your preferred platform for staying up to date on medical advancements?
There is no preferred platform I have. I think just various different platforms, really. I'm not, I don't get into sort of one area. It's sort of different areas, different platforms, different, productions, etc. that inform. Again, I think in today's day and age, there's so much information out there that you sort of gather it on as you read through. But I think probably I would say the biggest area that I learned from is from interacting with people. Just having a chat even with a patient or an attendant who's waiting on a patient teaches you much more than probably anything else.
Great. And last one word to describe your professional journey.
Amazing.
Thank you for that. And over to Dr. Asad.
Yeah, okay, thank you. Thanks for the rapid fire, and thank you for playing, Irfan. So Uzair has a question. Mr. Khan, now that you're managing or overseeing different hospitals in different countries, are the challenges in these emerging markets same? Good question.
So I like the way Uzair calls me Mr. Khan, but I would say, I think I sort of answered that a bit earlier, that there's a lot of similarities, but they're not, there's differences as well, so between the 3 countries that I'm running at the moment, I would say Pakistan and Nigeria are very, very similar. The cultures, the people, the governments, the issues very similar. Kenya, I would say, is different. And being a Kenyan citizen, I think I might be a bit biased, but I would say Kenya is a little more advanced. I think the problems there are more sophisticated, if that makes sense. So there's definitely an advancement in Kenya that has gone to a next level, and you feel that and you see that. So I would say the Kenyan market is very different than the Nigerian and the Pakistani market. But going back to one of the initial points I made, I don't think we should ever compare one country to another, because every country is unique, every people is unique, every culture is unique. And I think if you're going to be a good leader in any country, you need to understand that country and the culture, and then you can do the right thing.
Great. So Irfan, as you project into the future, like you think about emerging, not markets, but emerging technology, because that's another phrase we use a lot now, emerging technology. What skills and qualities do you think healthcare providers, doctors, nurses, other people in the team, if you think of like a unifying theme, perhaps, like, what kind of skills and qualities do you think they should have, thinking about where healthcare is headed?
So look, I mean, as you're talking, I mean, what the word that comes to my mind as a sort of a skill is resilient. People, in these markets, you have to be resilient. These are, every day, these markets are challenging. There's a new challenge every single day. It could be political, it could be transport, it could be weather conditions, it could be, food. There's just, you never know what you're going to face. So I think one of the things that is a success factor in these markets for someone who wants to be successful is to be resilient, and not to get worried about undue circumstances or issues, because you have to take them in your stride. So currency devaluation, availability of items, it's always happening. I mean, breakdown of equipment, spare parts, availability, these are things that in some countries they are taken for granted. Your equipment breaks down, within 10 minutes the part is there, they've replaced it, and no one knows what happened. But in our markets, it takes months for spare parts to get in, and your equipment is down. So how do you take that in your stride? What are the things that you do? So I think resilience to me would be sort of the key aspect. And I always tell my teams that if something doesn't go the way you think it should, that's just the way these markets are, and we should just take it in our stride and not stress about it and not worry about it, but do your best to handle it. And I think that is an important part. Yeah.
Excellent. Yeah, great. So one of the last questions that we tend to ask is what you've already actually, I think that would be a great kind of take home message for our students as well, if there are any students on this call. By the way, we have about 20-ish individuals, which is a great attendance for these webinars. And so thank you everyone for being here. So maybe there are students, medical students, nursing students, or other kinds of students. So resilience is what Irfan is talking about, right? So I think that's a great take home as well. Irfan, if you were not doing what you're doing, what would you be doing?
I don't know, actually. I can't think of anything else, because I've been doing this for so long and I'm really, happy doing what I do. I'm very passionate about what I do. But I think, if I was doing anything else, it would be to do with people, because I think I understand people well. I think I can manage people well. And I think that to me is a key, so that, in any industry, it's not about the equipment or anything else. It's about the people. And, you know, if you know how to handle and manage people and build relationships and develop these over the years, I think that to me is the most important thing. So if I was doing anything else, it would be, you know, something to do with teaching, training people, you know, somewhere there. So I think, you know, that's what I really get a kick out of.
Excellent. And by the way, that's like managing people or managing teams or establishing connections, synergies is one of the key pillars for innovation, creativity, and entrepreneurship as well. So yeah, so I'm kind of like amazed, and it's very satisfying to also kind of know that these kinds of things are how important these factors or parameters become in not just managing hospitals, but also being an innovator, creator, and an entrepreneur. So kudos. Thank you very much. And we've actually completed the hour, and it went by quick. Actually, it was a lot of fun talking to you. There weren't any awkward pauses, thanks to me. But Marine, back to Marine, and then she can wrap up.
Thank you, Dr. Asad, and thank you, Irfan, for being our guest. I would leave the audience with a few words that Irfan said, and they really resonated and created an impact. I loved how you said, you know, learn together so that you can learn to work together. An important lesson. If taught earlier, you know, teamwork is so important. So love the fact that you know, mentioned learning together so that learning to work together becomes easy. And how we spoke about emerging markets, which to me sounds like, you know, there's so much potential for growth, for innovation, for entrepreneurship. So I'm going to leave the audience with those words that were spoken by you. Thank you so much, everyone, for tuning in, and we'd see you soon. Thank you, Irfan, for being our guest.
Thank you. Thanks, Marine. Thank you, Dr. Asad.
All
Take
right,
care.
have a great evening, everyone.